Hello and welcome to the Pain Options Education channel. I'm Darren.
And my name's Tim.
Today we're doing the first in our ongoing series, the Pelvis series, and we're talking about the problem pelvis. This is just a little indication of what we'll be discussing over the next few education sessions. We're starting here just taking a pause and remembering about the burden of pelvic girdle pain to many people. My favourite research in this area, I guess, relates to 4 or 5 qualitative studies that really get to the heart of the matter for many people. And that's burden around not being able to interact with their families, interact with their children, and not being able to work. So it's a significant problem for many people.
And is it a bigger problem than other types of conditions, would you say?
I think the burden at an individual level is the same for all kinds of conditions. They affect people's lives in many ways. Some of the interesting stuff around pelvic girdle pain in particular is potential medicalisation of the issue. Yeah. It's a really common problem during pregnancy, and potentially many people will just get over it and get on with it. But there is kind of talk, particularly in Northern European countries, around pelvic girdle pain being medicalised and that feeding into the problem. So that's an interesting kind of aside, but really it's probably similar to other musculoskeletal conditions. Okay, this is a picture from Ngram Viewer. Ngram Viewer, for those that don't know, is Google's basically trying to scan every book in the world, and you can search any text in that. It's not scientific literature so much, more kind of general literature. But I think this kind of nicely illustrates the history of particularly around pelvic pain and the sacroiliac joint. So you can see the red line, which is a search on the word pelvic pain, and you can see this bump around the 1900s around where that term's much more common than you can't even see the blue line. That's low back pain. So at that time, the sacroiliac joint was actually thought to be the source of all back pain.
Right. So that, I guess, is a search on literature, is it? That was available at that time.
Yeah.
So around that time, in the 1900s early, there was publications about the pelvis or the pelvic girdle.
Yep. Yeah, and particularly around the sacroiliac joints, as I said, being the source of pain. Yep. But you see, low back pain doesn't even really trickle a mention there.
Yeah.
And we kind of carry along and start around, certainly around 1940, and we see a bit of a change where low back pain becomes more prevalent. Do you know what happened then, Tim?
A few things, but yes. Not in relation to low back pain, no.
They discovered the disc, Tim.
Oh,
yes.
So course.
Yes, of course. So around that time, the thought changed that the disc was the source of back pain, and then we see an escalation in consideration of back pain thereafter, and pelvic pain kind of tries to trickle along behind it. Around 1990, there was a spike in interest and renewed interest in research around the pelvis.
And I certainly remember around that time as a new, keen young physio, after I'd graduated, that there were a number of courses available on the pelvis, which I was keen to find out more about at that stage, so that probably fits with that time frame. Yeah.
So that'll be interesting to hear your thoughts on that as we go through this series, I think, as a reflection. So what is it about the pelvis that seems to be so mysterious, and maybe this is a reflection on what you learnt back then? What do you think?
Well, I was a young, keen physio around that time, and I was open to learning what was available, and the courses on the pelvis were certainly ones that colleagues seemed to be doing, and I didn't know much about it, and away I went to learn more. Yeah.
And did that help you?
Well, I thought it did at the time. I was told some interesting and convincing information about the importance of the pelvis, and maybe more importantly, tests that I could do to assess that, and even better, things I could do to treat that, to fix these pelvic problems.
Yeah, I remember, it makes me remember when I went in to do my year of musculoskeletal with Bob Elvey and Peter O'Sullivan at Curtin. And there was 2 things I really didn't know much about them, but one of them particularly I wanted to know about was the sacroiliac joint. And I distinctly remember having this patient that didn't have back pain. They had pain in their pelvis, and it was clearly different to me. and I didn't know how to manage it. So that was an interesting time for me. But then when you start to look at it, there's clearly these divergent paradigms around how to manage the pelvis, right?
Yeah, for sure. That was my experience. It was separate. It was a very different problem to back pain.
Yeah, and very different to any pain in any other area where these two strong paradigms seem to conflict. And we will explore that more as we go through this series. So, but it is, for whatever reason, while other things have evolved, the pelvis seems to be stuck a little bit.
Good choice of term.
Yes, it was, wasn't it? I made this slide up totally. So I will try and indicate when I made stuff up and when it's true. But when you look at the prevalence of back pain injuries, it's kind of easy because there's population-based studies. But there's not really the same for sacroiliac joints or pelvic pain, other than before I did mention pregnancy. So we can kind of say, yeah, 80% of women will have pain in this area during pregnancy. But in terms of trying to work out the balance between something that's in the pelvis versus something that's in the lumbar spine, it's quite difficult. All the studies that have tried to do that are really clinical population, so it's not like a population-based kind of analysis. Here, this is my take on it. I think that the lumbar spine problem is way more common than the pelvis. This is from working also in areas where you think there might be more with women's health, and I know you've worked closely with women's health physios as well, so I'll get your comment on it in a second. But yeah, I think, you know, low back pain problems are far more common than those in the pelvis. Sure, there's some crossover as well, and you're going to get that. I would also say that I think I would see almost as many people misdiagnosed with sacroiliac joint pain than I actually see have it.
Yeah. So a few thoughts there.
Yeah.
Most people with low back pain, they have pain in their back, and there's not that many things, obviously visceral organs, for example, that refer to the back. But people with pelvic pain, the back can refer to the pelvis, and a number of other structures and obviously pelvic organs can refer to there. So I guess using location isn't as good an indicator for pelvic girdle pain as it is low back pain. And the other thing around that is the literature does say the prevalence of back pain is greater than sacroiliac joint pain specifically, but the numbers there that are quoted around the prevalence of pelvic girdle pain is quite high or quite broad, isn't it?
Yes, yeah. I mean, there's one classic study, you know, that only had about 100, maybe 200 people, but it said 30% were from the sacroiliac joint, which I just find very hard to believe.
So of people with lumbosacral pain that you see, what proportion would you say, based on when you examine them, that the sacroiliac joint is the source of symptoms?
Less than 5%.
Less than 5%?
Yeah.
Okay. Well, I'd agree. I'd say even lower.
Yeah.
But that's obviously the patient population that we see.
Yeah.
Yeah.
Yeah. But interestingly, when I worked closely with the women's health physios, I'm not convinced it was so much more. I mean, there was definitely cases during pregnancy, of course, but
sure.
It brings up, we've both used the terms pelvic pain and pelvic girdle pain, so it's probably worth just quickly describing those terms, where pelvic pain is the overall umbrella term, but as you quite rightly mentioned, that can involve viscera, other things, other than musculoskeletal, where pelvic girdle pain is really reserved for musculoskeletal kind of disorders of the pelvis.
So that would be usually around the sacroiliac joint or symphysis pubis if we're talking bony structures.
Yeah, and potentially the coccyx. Yeah. We'll explore that more as we go on. So I guess the thing out of this to me is, like, if you're a clinician and you think 50% of your people have sacroiliac joint pain, you'd have to question it.
Well, you should be questioning it.
Yes. Well, that comes up to questions. That was good timing, wasn't it? Any questions, Tim?
No, it's an interesting topic. There will be more questions arising. Obviously, people can send questions through to us if they have any, but hopefully those will be explored and answered as we go along in the upcoming sessions.
Yep, so please do send your questions through to education@painoptions.com.au, and we may occasionally check that email address, Tim. So we look forward to speaking to you again over the rest of our topics of the pelvis series. Thank you.
Thanks.